Hey guys! Welcome back to our channel. Today we're going to be discussing a paper called Outcomes of Urinary Tract Infection Management by Pharmacists, a study of pharmacist prescribing and care in patients with uncomplicated urinary tract infections in the community. This study was published in the Canadian Pharmacist Journal in June of 2018. So this study is called a prospective registry trial, which basically means it's a passive observation seeking to measure the effectiveness of an intervention. The authors specifically state that the study was meant to capture data reflective of real-world practice. As such, there is no direct comparator, but the authors used published data on the rates of UTI cure as a comparison.
So, what is the clinical question of this study? In adult female patients with acute uncomplicated urinary tract infections, does pharmacist intervention, including prescribing, improve outcomes in terms of clinical cure? So our population for this study was 750 females aged 19 plus presenting to the pharmacy with symptoms of uncomplicated urinary tract infections. So patients were excluded if they had any complications such as being of the male gender, signs of systemic illness, pyelonephritis, or recurrent urinary tract infections. As an intervention, the pharmacist would assess for symptoms of a UTI, determine if there were any complicating factors, and then, if appropriate, prescribe antibiotics. If deemed inappropriate, the pharmacist would provide education to the patient and/or refer the patient to a physician for follow-up.
So of the 750 people who were included in the study, 94 of them were actually called the physician initial arm, which means that they presented to the pharmacies in the study already having a prescription from a doctor. In these cases, the pharmacists either filled the prescriptions as prescribed or they made modifications as appropriate.
So the primary outcome of the study was there a clinical cure or not? But they also put a large emphasis on patient satisfaction. Mm-hmm. So is getting a prescription for your UTI from your pharmacist something that you're interested in as a patient?
Mm-hmm. Which I think is really important because this was actually one of the first studies of its type that really took pharmacists prescribing for UTIs, which is a fairly new intervention in Canada, and not only seek to assess how effective it is, but also wanted to see how patients feel about it.
So one of the things we were asked to talk about in this video was whether our paper was referenced in the most recent guidelines for our condition, which is urinary tract infections.
Mm-hmm. It's interesting because this morning when we were kind of looking around for other papers that are out there, we found out that the authors of this paper actually helped write the guideline, because the guideline for prescribing for UTIs for pharmacists was written, I think it was 2017, and then this paper came out about a year and a half after that. So they basically wrote the guideline and then put it to the test, which we thought was really cool.
So something else that I really liked about this study is that it actually had a really high follow-up rate. It was upwards of 91.4%, which I think is really impressive.
Mm-hmm. Yeah, so they followed patients 2 weeks after initiation of therapy just to make sure there was no recurrence of symptoms. And they stated that that type of follow-up rate of 91.4% is actually very high in real life situation, especially for an acute illness, something like UTI. People tend, once it's cured, they tend to kind of like forget about it, maybe lose interest in the study. But the researchers in this study were actually able to get pretty good follow-up rates with everybody.
So on that note, I think it's also important to recognize that the sample size for this study was actually quite large. I mean, 750 people across a relatively small province is pretty impressive.
And those 750 people actually came from 39 different pharmacies, which may not seem like a large number in terms of all of Canada, but like I said earlier, there's no other study out there that does anything like this. The only other study that we could find that even existed was done in Scotland, and it was on less than 100 people in less than 10 pharmacies. So really, this is a big sample size for the type of research that it is. So on that note, where all the patients kind of came from one Canadian province, everyone was taken in New Brunswick. We can kind of consider that a weakness, that there was not really a whole lot of patient diversity. There was no outport communities really included in the study. It was all just in one location in New Brunswick. But I think it is a good starting point for this type of study.
The researchers made it very clear in their study that patient satisfaction was a high priority. And another weakness would be that there was only about a 53% response rate in the survey,
yeah.
Right. But the results of the survey say that 95% of patients who participated would recommend seeing a pharmacist prescriber to other people.
Mm-hmm. So what do you feel like the overall bottom line of the study was?
I definitely think that the main goal of the study was to, set out and show the evidence. Pharmacists can do this, it's safe, it's effective, why not let them do it?
Mm-hmm.
You can apply this in everyday community pharmacy That's huge. That's so accessible.
The authors of the study weren't trying to prove that pharmacists' intervention was better than physicians. They were just trying to show that it's as good as. So they were just trying to show that them assessing patients, prescribing antibiotics, and performing the follow-up was just as efficient or effective in having a cure rate in UTIs as it was if they saw a physician.
So I'd just like to thank everybody for joining us today on Esther and Dylan's YouTube channel.
Yeah, you guys can like and subscribe, comment down below which article you'd like us to critically appraise next time, and we'll see you then.
Bye!